Hello, this is Miss Stephanie from Let's Talk About It at Willard Library. Please feel free to like and share and let everyone know that we air this segment every first Thursday of the month. And we are so pleased to let you know that we have two organizations that we are interviewing. And so we're going to start it out with Scott. As many of you know, September, or you might not know, but it's important to know that September is Suicide Prevention Month. And so we thought it would be a great segment to have Scott here to talk about all the events that we have to make people more aware of what we can do to prevent suicide. So thank you for being here.
Thanks for having me.
First of all, I'd like for you to share your story. What makes you passionate about suicide prevention, Scott?
Well, to answer that and even to just explain why I do what I do. So, as Stephanie said, as you said, I'm the Suicide Prevention Facilitator for Summit Pointe and lead the work of the Suicide Prevention Coalition of Calhoun County. The reason I got into this work, and I've worked in behavioral health for over 12 years now, the reason I got involved is because before being on the providing end, I was on the receiving end of mental health services. So I struggled with anxiety, depression for a number of decades, really, and I am a suicide attempt survivor. So I had a point in my life when I was 24 years old where I attempted suicide. Thankfully, somebody saw something. First responders saved me, and it was a long road of recovery after that, but that's why I do what I do and why Suicide Prevention Month is really important to me.
Wow. Well, thank you for turning your pain into purpose. And with that, tell us all the things that we can do to save a life.
So with Suicide Prevention Month, we're really hoping to get everybody involved. And if you can see the sign next to us here, suicide prevention takes a community and it starts with you. It is not something that is should be just left up to mental health professionals. It's not, and it's certainly not something that people should deal with on their own in isolation. So if there's one thing that I would say you could do to prevent suicide is to get trained. Get trained. We offer a free suicide prevention training called Qpr. Many of you are probably familiar with CPR, which is life-saving support for somebody facing a cardiac crisis. Qpr is life-saving support to help somebody facing a suicide crisis. So in the same lines, it teaches to recognize the warning signs, and then to know that once you recognize those warning signs that someone might be thinking of suicide, that means you have to do something. You have to reach out. You have to be there for them. And Qpr is an acronym. It stands for Question, Persuade, Refer. So that's really the three-step plan that we teach. How to be there, how to really show up, be there, and support somebody and get them connected to additional support. So number one thing for Suicide Prevention Month, and typically this training is between 60 to 90 minutes, so in as little as an hour. If you can dedicate 1 hour to potentially save a life, I think all of us would say that's worth it. So yes. We offer this monthly for free online via Zoom. The third Thursday of each month, and we'll be doing that. And I'll go over our calendar, but we can also come to you. So Stephanie and I are both Qpr instructors. We have a team of 14 Qpr instructors in Calhoun County, and we can come to you, provide this training in person. So that could be at your workplace, that could be at your school, if you're part of a men's group, if you're part of a women's group. This is something that impacts all of us. So get trained, that's the number one thing. But on top of that, because it is Suicide Prevention Month, we'll have a variety of opportunities, events, trainings, groups that you could participate in. So starting with the first one I'd like to mention, so September is Suicide Prevention Month. World Suicide Prevention Day is always on September 10th. And this year, that falls on a Saturday. So we thought, over the last few years, our coalition has done a chalk campaign throughout the whole month where we pass out chalk packets with just a couple pieces of chalk and then instructions of some suggestions of things you could write, but hopeful messages, uplifting messages, and then really spreading the life-saving resources like our 1-800-CRISIS helpline, and then now across the country we now have a 3-digit number, 988, that people can call or text for crisis support. So we've done that chalk campaign for a number of years. So this year for World Suicide Prevention Day, we are going to be going to 6 different stops in the county. We're going to start in Battle Creek here in front of Willard Library at 9 o'clock, and we will be chalking here. We'll have a group that will probably be here for 30 to 40 minutes chalking, passing out chalk packets, and then moving on to the next stop. So starting at Battle Creek at 9, we'll be at Athens at 10 o'clock, Teconcha at 11, Albion at 12, Marshall at 1, and Bellevue at 2. And like I said, at each stop we'll be there about 35 to 40 minutes before we move on, but we're hoping that the community will come out, chalk with us. We'll have some free giveaways and resources that we'll be handing out then as well. And so that there will be some other things going on that day as well. So as we're wrapping up our chalk event, some of us will be going to another event at the Battle Creek Eagles, which is the Ride for Awareness. So it's a motorcycle ride that will be going around the county as well, and then finishes with a dinner together. And that's a really great event. I went last year. So some of us will be going there, and then there's also going to be an event in Marshall, Michigan at the Fountain that starts at 3 p.m. and goes until sunset, where they're going to have luminaries. And the fountain there will be lit up teal and purple, which if you can see my bracelet, those are the colors designated for suicide prevention awareness. Okay. So that's World Suicide Prevention Day, but after that, so that's September 10th, a Saturday. The next thing coming up is our monthly Qpr Lunch and Learn Qpr training, which will be Thursday the 15th from noon to 1. And registration for that is online at the URL, if you'd like to sign up, is spccc.eventbrite.com. That's 3 C's for Suicide Prevention Coalition of Calhoun County. So spccc.eventbrite.com, and sign up for that. Join us on the 15th. Then the next thing we'll have is our monthly Suicide Prevention Coalition meeting. So our coalition, we're open to anybody that wants to join us. So if you've been impacted by suicide, whether that could mean maybe if you've lost somebody, if you've supported somebody who has struggled, if you yourself has struggled with thoughts of suicide, or even if you've survived a suicide attempt like myself, we welcome you to come. Or if you're just passionate about helping people, or if you work in a profession that involves supporting people that might be dealing with suicidal thoughts, please join us. So that meeting will be on the 21st, which is a Wednesday at 11 o'clock. And hopefully we'll get my contact information out for anybody that's interested for that. Get a hold of me. Then the next thing after that, we have our monthly Survivors of Suicide Loss support group, which we meet here at Willard Library. And that is going to be on the 21st, Thursday, from 6 p.m. to 7:30 p.m. And I mentioned Stephanie, our Qpr instructors. We are also both 2 of our facilitation team for that support group. So really important for people that have lost someone to suicide to be able to grieve in the same ways we would grieve the loss from someone who's died in any other way. But for a variety of reasons, sometimes that's more difficult. So really important to be able to get to sit with and talk with other people who have that shared experience. So that's on Thursday the 21st, and then on Monday the 26th, we'll be doing a Qpr Instructor Training. So if there's anybody that would like to join our instructor team, that's going to be a 6-hour training that will be online. So you can sign up for that on that Eventbrite page as well. There is a cost for that one. That is $510 to be certified as an instructor. But if anyone's interested, please register for that, reach out. And then on the 28th, we will be showing a free film screening of Coming Up for Air. It is a film that deals with mental health, with suicide risk, kind of deals with a young college athlete and how eventually finds support, what he goes through, what his family goes through. So that's going to be a free film at the Bohm Theater in Albion, and for anybody that shows up, we'll have free pop and popcorn.
Wow.
So that is September 28th, and showtime for that is at 5:30. Right after the screening, we're going to have a small panel discussion where people who have been impacted by mental health, and impacted by suicide in a variety of ways are going to have a panel discussion after that. And then we don't have a date for one more event. We plan to do a town hall meeting on workplace suicide prevention. So be on the lookout for the announcement for that. We don't have a date set yet, but if we looked at the last 10 years of suicide deaths in Calhoun County, so community members that are no longer with us that died by suicide, the vast majority of those have been individuals in the working adult age years, so kind of between 25 to 64.
Wow.
So workplace suicide prevention is something we should be focusing on, something that's really important. And there's really no age group that is not impacted by suicide, so we should, from young to old, it's something we need to be aware of.
Right.
And again, best thing to do is get trained.
Yes.
So that's some of the events we have. Events, meetings, trainings we have going on in September for Suicide Prevention Month. So hopefully people can come out and join us for some of that.
Right. So if you're just tuning in, this is Scott through Summit Pointe and Suicide Coalition. Am I saying that right?
The Suicide Prevention Coalition of Calhoun
County. If people want to, because this is a lot of information, a lot of much needed information and relevant events that are happening, where can they go to find out all this information?
So the two easiest places to find us, we have a Facebook page.
Okay.
And if you search Suicide Prevention Coalition of Calhoun County, you should find us. So we have a Facebook page and then also that Eventbrite page that I mentioned. And the easiest way to get that, you could go to eventbrite.com and search for us, or you could also type in the URL spccc.eventbrite.com. So those are the two easiest ways online to find us.
And we'll try to have some of this information posted on our event wall of things that are happening in the community. What else would you like to share with us, Scott?
Well, so in the theme of suicide prevention, we know that globally, so suicide is an issue that affects every community across the world. When we've seen reductions in the global suicide rate, the initiatives that had the greatest impact typically revolve around what we call lethal means safety. So really, lethal means safety, what that means is putting as much time and as much distance between a person that might be thinking about suicide and any potential lethal means. So in the United States, that means we should be creating safety around things like firearms, medications, or really any other potential lethal means that person may have thought of, been exposed to, or maybe even if they have a suicide attempt in the past. Putting time and distance save lives. So for most people that have attempted suicide, and we have a pretty good guess, even those that have attempted and died by suicide, we know for the vast majority there's ambivalence. So that for many people there's a desire to die, but there's a desire to live. And usually, if we think about a crisis, so the moment of a crisis, really where there's the peak risk for a crisis, for most people lasts a matter of minutes to hours. So minutes to hours, if somebody's able to make it through that window without making an attempt, a lethal attempt, they survive. For many people, if they're able to wake up the next day, that that desire to die by suicide is drastically diminished. So lethal means safety is important. So I just brought a few things. As the coalition that we give out, we do give out gun cable locks. So this is just one step. Gun safe or a locking gun case would certainly be better, but these cable locks are better than nothing. And if possible, ammunition and the firearm should be stored separately, also locked up. And most importantly, if we think about youth, so youth have been increasingly using firearms in suicide attempts, and so just making sure that anybody that shouldn't have access to your firearm doesn't.
Right.
It's really important. So that's one of the things we do. And I should mention, we partnered with the Sheriff's Department to be able to distribute these.
Okay.
And then we partner with Public Health to be able to distribute medication lock boxes.
Wow.
So if you have prescription medications, or you could even put over-the-counters in here.
Wow.
Even if somebody has other substances in your home, having them locked up, inaccessible, just so that people that shouldn't be able to have access don't. So that's another thing. And then another thing that we distribute as the Suicide Prevention Coalition is our Narcan kits. So which can temporarily reverse the effects of an opioid overdose. Because we do know that drug overdose, there's a lot of overlap with suicide attempts and drug overdose. So lethal means safety is something that's really important. We want to encourage safer homes to have safer communities.
Right.
So that and then getting trained are really two of the biggest pieces. Knowing how to help somebody, knowing how to recognize the warning signs, and actually reach out and provide support, get them connected, and then just having safer homes so that people can live through those difficult moments. And I think the best way to do that is to live through those difficult moments together.
Yes. Wow. Thank you so much for sharing this information. It's very important. I am grateful that September is the time. I mean, we need to do it all the time, but I'm grateful that we have a month that we can really focus on this important topic, because we've all been impacted one way or another. And I just want to remind people, in case they didn't catch this, I know we dial 911 for emergency, but the suicide crisis line is 988. So if you or someone you know is in a crisis, dial 988. Again, this is Scott. We thank you for coming in and sharing this information. Feel free to contact me, Miss Stephanie, at 269-968-8166, extension 501, if you have any questions about these two segments. This one is on suicide prevention. The next segment is Diane from Grace Health. Hear about all the information they offer as well. Thank you for listening. Please let other people know, and have a great day. Well, good evening. So today with us, thank you, Miss Diane, we have Diane from Grace Health, and she is going to share with us all the resources that Grace Health has right here in Battle Creek. So good evening.
Well, thank you for having me. Grace Health actually started in 1986, and at that time we were known as the North Avenue Women's Center, and we provided just women's services when we opened. And as time went on, women are having babies. Who takes care of the baby? Who takes care of that child? So we decided we need to add pediatrics, and then as time went on, why aren't we seeing the whole family? So we added on the family practice. So more and more services were added as we saw the needs in the community, and then we could expand. Now in 1992, the name was changed to Family Health Center of Battle Creek.
Okay.
And at that time, we got recognized by the federal government as a federally qualified health center.
Wow.
And then, moving forward quite a bit here, in 2015, we changed our name from Family Health Center of Battle Creek to Grace Health.
Okay.
So we are known as Grace Health now. But our services include, not only do we have the OBGYN, family practice, we have internal medicine, pediatrics, we do dental, we have behavioral health, we do physical therapy, we have vision or optometry, we also have podiatry, And then we have a pharmacy on site.
Wow.
And our pharmacy on site is open to everyone. So you don't have to be a patient in order to use the Grace Health Pharmacy.
Wow.
But not only do we have those services, but there are other things we do, like we have centering pregnancy, and that's where a group of women who are all expecting about the same time, they get together, they meet with a provider, meet with our staff, and they teach them of different things that they expect that might happen during their pregnancy. They can share with the other women in the group, this is what I'm going through. We find out that, oh, everybody else is going through the same thing. Wow. So you don't feel alone. They can share their experiences or share, oh, hey, this helped me. Maybe this will help you, or, you know, and so they build that rapport with one another. So it just is another way to educate.
Right.
And as you're going through something, you know, so that you know, or have that resource or somebody else you can, you know, talk with, connect with. We also have a fresh food initiative that we do every Monday, so people can get, you know, fresh food. We work with the food bank, so if we have patients that have a need, they can get those fresh fruits and vegetables and stuff. We have a Reach Out and Read program, which started in 2004.
Reach Out and Read?
Reach Out and Read.
Wow.
And fortunately, I've been a part of it since it started, so I've got to see that grow. And we are recognized by the National Reach Out and Read as a Reach Out and Read program. And when we started, we gave out books to children 6 months to 5 years of age when they came in for their well child visit. Mm-hmm. And as the years have gone on, and looking at the research that the National Reach Out and Read did, we realized, you know what, maybe we should be giving these starting at birth.
Right.
And that's kind of what the National Reach Out and Read was recommending, because a lot of your brain development happens in those very, very early years. And
Yes.
they were finding that the sooner you get a book in a child's hands, mm-hmm. the better it helps with their brain development and the better they do in school. And so we wanted to be a part of that. It's not just helping our patients with their health care, but it's how else can we help them and meet their needs. And so we started giving the books from birth on up to 5 years of age. And that's just been great. I mean, it's fun to watch a child's face light up when they get that new book.
Right.
And some of these children, maybe that's their only opportunity to get a book.
Right.
And I always think of this experience. We were in the waiting room. We had got some funding so we could give some extra books just to anyone at one time. And this lady walked up to me with tears. And she said, I just want to thank you for this book. Because she said, I wanted to get my kids books, but I can't afford them. And she goes, I look for them at garage sales if I can get them, and to be able to get a brand new book. You know, and I thought, oh, that's why we do this. You know? So that, it just always touches, because you don't realize maybe what the impact some of this can have. So I mean, that was, you know, so it's fun to be a part of that. So we have, you know, these resources. We also have our community health workers and our resource specialists. They help our patients by connecting them with other services. You know, if they find there's a barrier, patient says, I can't get to my appointment. They talk with them, figure out what the barrier is. Is it transportation? Is it something else? Or, you know, so they work with them and help connect them to help maybe reduce those barriers so that they can get the services they need or the health care they need. So all sorts of, you know, we do more than just, oh, I don't feel good today.
Right.
Okay, you know.
Yeah.
So we are working to kind of meet all those needs that we can, or connect, you know, people to.
I had no idea. So, real quick, my question is, you know, we're living in a world where it's hard to get an appointment, or the appointment takes forever, or, you know, you don't have the right insurance or whatever. What does someone have to do to become a patient of Grace Health?
Well, you just need to give us a call.
Okay.
And if we've got an opening, we can get you in.
Okay.
Now, I will say, we've been affected by the pandemic like everybody else.
Yes.
So we are shorter staffed.
Okay.
We have really ramped up our recruitment efforts, and so that we can, you know, get more people in there.
Okay.
So that we can get people seen.
Mm-hmm.
Because we do want to see people and see patients. So I know sometimes people get frustrated because it might take a little while to get in.
Right.
But yeah, all it is just a phone call.
Okay.
We will see anyone.
Mm.
It does not matter your income.
Okay.
It does not matter your race, your ethnicity. Does not matter if you're female, male.
Mm-hmm.
It does not matter.
Wow.
We can see anyone and everyone. And if you don't have insurance, you can always talk with our patient account
Okay.
representatives. They can help get you connected. Maybe there might be some resources out there that you might qualify for
Okay.
to help you. We do have a sliding fee discount program.
Okay.
And so the minimum amount that someone would have to pay is $5.
Wow.
And that, we base it on income and family size.
Mm.
So our patient account representatives will work with you and look at what your income is, your family size, and then say, okay, this is what you qualify for.
Okay.
And even if someone can't afford that $5, we will work with them.
Wow.
It's not going to be a matter of, oh, so sorry, you
Right.
can't come in. We are going to work with them and see what we can do to help them.
That's good to know. Now, this may be a silly question, but it just came to my mind. Do you offer any urgent care? So let's say there is someone that comes here to the library and we noticed that there could be some medical challenges that they have. Could we say, try going to the Grace Health or?
Well, we're not an urgent care center.
Okay.
We're just like, I'm going to say like a doctor's office, but we're a little different because we do have all the other services. I'm going to call them wraparound services.
Wraparound, I like that.
So we're not like an urgent care, like,
Yeah.
like you run to the emergency room or,
Right.
run to the other urgent care centers. We're not like that.
Okay.
So.
What about walk-ins? Is it appointment only?
It is appointment only.
Okay, that's good to know.
We did have walk-ins prior to COVID, but we have not opened back up to walk-ins
Gotcha.
yet. We used to have some walk-in hours. Maybe
Okay.
someday we'll have that again.
Right.
At this point, I don't know. Just
Okay.
depends on how
That's good to know.
it goes
Yeah.
with, the pandemic. But at this time, it is as appointment only.
Okay.
We still do provide virtual visits and in-person visits. So if somebody's like, I'm just not comfortable coming in, or we can do a virtual visit.
Okay. Okay. Virtual is good.
So
too.
we have both.
Okay.
Depends on what you prefer.
Yeah. That's good to know.
Yeah.
And then I think you also help out with mental health as well.
Yes,
you have
we
that
do.
type of service
Yep,
too.
we do.
That's great. That's great. Now, do you offer services for people that have foreign language?
Yes.
Okay.
Yes.
All
We
right.
do have staff on site.
Okay.
We have some staff that can speak Burmese and some
Okay.
that can speak Spanish.
Okay.
And then we also use services if somebody has another language that they speak. We have a little iPad thing where there's an interpreter,
Oh.
and so that interpreter will be with them and work with them.
Wow.
So yes, so if you speak a foreign language, we can still see you, and any of the services we provide, you can still get.
Wow. So if you're just tuning in, we have Diane from Grace Health, and she's talking about all the services Grace Health has available. So make sure you go back and listen to all the services they have, because they offer a wealth of resources to the community that I'm just finding out about, and I've lived here all my life. So this is awesome. Can you tell us the address?
Our main site is located at 181 West Emmett Street, which is right on the corner of Washington and Emmett.
Okay.
We also have a site in Albion. That site offers just dental services. That's at 115 Marketplace in Albion.
Okay.
And then, believe it or not, we are within 11 schools right now.
Wow.
So we offer, some schools we provide just behavioral health services. Some schools we're offering, they call it a child and adolescent health center, which that means there's a provider on site, and there's also a mental health provider on site. So students don't have to leave school premises to be seen. Parents can sign consent that if you know their child isn't feeling well, needs to be seen, that gives us authorization to see them. So
Wow.
that way, mom and dad don't need to take off from work.
Right.
And students can just come in or if a student needs help, behavioral health, mental health, we have a provider there on site
I love it.
to see them.
And so what are the hours off-site and within the schools?
Well, our main site is open from 7:30 to 6:30 p.m. and I'm going to refer people to look at our website
Yes.
because with all the different sites, they all have different hours, and our website is www.gracehealthmi.org. And
Okay.
if you just click on the contact and hours, you'll see that no matter what page you go on, it's right at the top. Click on that. Excuse me.
That's fine.
And it'll show you all the hours for our different sites.
Okay.
And it also will list all of our school sites and which ones offer like the child and adolescent or if it's just the behavioral health services that they provide. But we're in Battle Creek Central. We are in W.K. Kellogg Prep. We are in Northwestern Middle School. We're in Springfield. We are in Homer Schools, Lakeview High School. We have behavioral health services at Verona, at Dunlap, North Penn, and we also are going to be opening a new site at Harbor Creek High School.
Wow.
That'll be opening up this year, and that will be mental health, behavioral health services to start.
Wow. I'm impressed that you knew that off the top of your head. Very impressive. Wow, I had no idea. The other thing I thought about is here at the library, we do get a lot of the 18 to 25 age, that new age adult. One of the things that I'm wondering is, and I know you talked about this a little bit, if they are having some medical issues and they have challenges with even knowing how to fill out something for Medicaid, or what would you suggest for that age group?
Well, we do have staff that can help them, so if they're at a school site, the staff there can help them. If they come to our main site, we have our patient account representatives that can
Okay.
help them. So staff will help them with the forms
Good.
so that they can get it filled out.
Okay.
So we're happy to do what we can to help them.
I love that. So again, this is Diane from Grace Health. We are so excited that you were able to come, first of all, and I am just so in awe of all the services that Grace Health offers. And if someone wanted to know all the services, is that on your website?
Yes, it
Okay.
is. Yep, it's on the website.
All right. And then the reading portion of it, of course, that intrigues me because this is the library.
Yes.
Do they must be a patient in order to have those services?
Well, for our Reach Out and Read program, they would need to be a patient because we give them out during the well child visit.
Okay, okay.
And so they would come in for their well child visit, and then they would be given a book during that visit, and the provider talks with a parent or guardian, about the importance of reading and how to read to a child.
Mhm.
And it also opens the door because maybe parent or guardian needs some help with reading, or needs some help with their literacy.
Right.
And so it opens a door that we can help connect them maybe with a service to, get some help with literacy. Now we do have a few books for like older siblings. So
Okay.
like if an older sibling comes and a brother or sister gets a book, and so we can give them a book too.
I have one more question. Sometimes there is a stigma that goes along with being, family health care or Grace Health. is there anything that you would like to share to kind of erase some of the stigmas that people may have about coming to your center?
Well, I have, one part of my job, I get to go out to health fairs every now and then. And one thing that's a common thing that people have said to me, oh, I can't come there. And I'll say, well, why? Well, I'm not poor enough. Or I don't really, I'm okay, I don't need your resources. And I'm like, but that's not true, because we see everybody. Doesn't matter your income. And you know, and some people think, well, you know, it's just for poor people. And I always love to hear people when they walk into our center and they're like, wow, this is nice. Because I think some people think, well, because it's for poor people, it's got to be dingy, dirty, not well cared for. You know, sometimes they have that. And then when they walk in that door and find out that this is a nice building.
Yes.
Because, I mean, we keep it up. I mean, we have a great facilities crew that they're around there cleaning, touching up paint, they're, you know, and some people will be like, is this a new building? You know, as they look around and it's like, no, it's not new, but I mean, it is well cared for. We take care of, you know, and so it is a nice place. And, you know, and like I said, we see everybody, and some people think, you know, yes, we do have programs that we can help those that have more needs than those that maybe don't need as much help. But it doesn't mean that, yeah, it is for everyone.
I love it.
And we are here for the community.
For the community.
And that's one thing that, you know, we talk about, we are here to serve.
Yes.
And that's what we want to do, is serve the community and be a part of the community. And so we do kind of watch, what does that community need?
Yes.
And that's where we, you know, look at adding services or sites, or what can we do to help meet that need or kind of fill that gap.
I absolutely love it. Thank you so much for sharing.
Thank you for having me.
Wow. And if you have any questions, please feel free to call Willard Library at 269-968-8166. My name is Miss Stephanie, and my extension is 501. And what is the telephone number to Grace Health?
Our main number is 965-8866.
Okay. Thanks again for coming, and I hope you all use Grace Health as a resource. I have, and I have been very impressed with what I've seen and what I have experienced. So thank you for what you do in the community.
Well, thank you for having me. I appreciate it.